The breasts are a pair of organs that sits directly under the skin on the chest. On the outside of the breast is the nipple. A darker circle of skin surrounding is called the areola. In women, breasts are made of fatty tissue, milk-producing glands, and tubes called ducts. A large network of lymphatic vessels and lymph nodes sits in and around the breast. Fluids from the breast drains through the lymph vessels into the lymph nodes. If the fluid contains harmful substances such as bacteria or viruses, immune cells inside the lymph nodes attack and destroy them. From there, most of the fluid passes to lymph nodes under the arm, then to other lymph nodes and vessels, emptying into the bloodstream. Most breast cancer starts in the ducts of the breast, but it can grow in any parts of the breast. Here, cancer cells form from duct cells lining the ducts. They can grow and multiply to form a cancerous tumor. Over time, the cancer cells can spread through the lymph nodes. The following may be signs and symptoms of breast cancer. Note that these signs and symptoms are not all-inclusive. During a routine breast exam, you or your doctor may feel a small heart lump in the breast or under the arm. In addition, you may have some liquids coming out of your nipple, or you may see dimples in the skin of your breasts. The doctor will use certain terms to describe the progression of the cancer called staging. Staging for breast cancer is complex. The following staging descriptions are meant as a general overview and are not all-inclusive. Stage 0 means abnormal cells are found but have not spread beyond where they started to other tissues in the breasts. Stage 1 means the tumor is smaller than 2 cm within the breast tissue. Stage 2A means the breast may have cancer in lymph nodes in the armpit, or it can be a tumor 2 cm or smaller with cancer in the armpit lymph nodes. Stage 2A can also be a tumor of between 2 to 5 cm with no spread to the lymph nodes. Stage 2B means the breast may have a tumor of between 2 to 5 cm with cancer in the armpit lymph nodes, or it can be a tumor larger than 5 cm with no lymph node spread. Stage 3A means the breast may have any size tumor with cancer in the armpit lymph nodes, or it can be a tumor larger than 5 cm with cancer in the armpit lymph nodes. Stage 3B means the tumor may be any size, and cancer may have spread to chest wall, the skin of the breast, and or lymph nodes in the armpit. Stage 3C means the breast may have no visible tumor or any size tumor with spread to the lymph nodes in the armpit, breastbone, or around the collarbone. Stage 4 means the cancer has spread to distant organs. You may be wondering how you got breast cancer. While it's impossible to predict exactly who gets breast cancer, there are some things that can increase the risk. Being female, increased age, taking hormone replacement therapy, having your first child after the age of 30, exposure to chest radiation, and a family history of breast cancer. This list is not all-inclusive.